Hi, this is Dr. John Shim, and today I want to talk about a very common and controversial topic, and that's the use of ice versus heat for back pain. We all know that for acute injuries such as sprained ankles or twisted knees, using ice is the preferred method. It decreases the inflammation, decreases the pain, and in contrast, in these acute, horrible sprains and strains and even breaks, if you use heat, you actually increase the inflammation and may actually cause more pain and discomfort. Well, does that apply to your back? Well, it turns out it's relatively controversial, but in my opinion, if you think you really pulled or stretched the muscle or tendon or ligament of your back and it's really very, very painful, I do think ice is a benefit to you. Ice has that property of cooling the skin, therefore cooling some of the nerves. Ice also has that property of decreasing the inflammation, so it could be beneficial for you. But there are some cautions we must take when we use ice. Never put ice directly on the skin because it could potentially cause frostbite. Always use something like a towel barrier and do not apply it on the skin for more than 10 or 20 minutes at a time. You can repeat it as often as you like after you give some recovery time to your skin. When you use ice, make sure you rest during that period of icing. I can't tell you how many times I see people walking around with ice packs or doing work with ice packs, still pushing, stretching, pulling on their muscles. In a way, you're kind of defeating the purpose of using the ice, because the ice is there to decrease the inflammation and swelling. If you keep pulling and tugging, you're actually flaring up the situation again. So rest during the period of using ice. Ice packs can be gel packs, frozen towels, or even a package of frozen peas. Folks with certain medical conditions such as Raynaud's disease, loss of sensation to the area, or paralysis should avoid ice therapy. Studies have shown ice can be beneficial, but more studies need to be done. Now I want to switch gears and talk about the use of heat. It turns out heat therapy can be beneficial for chronic back pain and stiffness, but not for acute injury. Remember that. As I talked before, in acute injuries, you can actually increase the swelling and inflammation. In chronic conditions, chronic stiffness, heat can help dilate the blood vessels and deliver more nutrients to the sore and stiff area. Heat helps stretch the softer tissues, including the muscles, ligaments, tendons, and it eases stiffness. Forms of heat include a hot water bottle, use of a sauna, or a warm bath. For those with loss of sensation or paralysis, you have to use caution because it can be too hot or you won't feel how hot that area would be. Remember not to apply a hot water bottle for more than 20 minutes at a time, and use some common sense and don't stay in a sauna for more than 15 to 20 minutes. Always check your water temperatures, both with the water bottle and before getting into the bathtub. Studies have shown some limited benefit to heat therapy, and more studies need to be done to prove its benefit. An alternative treatment is to rotate cold and heat therapy every 15 to 20 minutes for chronic conditions. But remember the general principle. Avoid heat for acute injuries, use heat for chronic stiffness and chronic arthritis type conditions. This is Dr. Shim talking about the use of heat versus cold in treating back pain. Thank you for listening.